Welcome back. An outbreak of a parasitic infection in Michigan has more than doubled since just a few days ago. State health officials say there are now more than 3,300 cases with 44 people in the hospital. The infection is called cyclosporiasis. It can cause weeks of severe diarrhea. It's caused by a parasite that contaminates fresh produce. Now, according to the Washington Post, federal and state health officials are investigating whether fresh ingredients served at some Taco Bell restaurants played a role in the outbreak, but the fast food company responded, saying in part, quote, "Public health officials have not confirmed a link to Taco Bell or any specific ingredient, supplier, restaurant, or retailer. While authorities continue their broader review, Taco Bell has voluntarily and temporarily removed limited ingredients at select restaurants as a precautionary measure." CBS News medical correspondent Dr. Celine Gounder joins us now with much more. Dr. Gounder, thank you for your time. So what's actually causing this sickness?
So this is caused by a parasite called cyclospora, and it spreads through fresh produce that's either grown or rinsed in contaminated water. And so this outbreak is big, it's moving really fast. Just in Michigan alone, we've seen over 3,300 cases, 140 people, more than 140 people hospitalized from dehydration as a result of this. But as you said, we still don't know the exact food that is at the root of this outbreak. And part of the issue is it can take people 2 weeks after consuming contaminated food before they develop symptoms, which means that by the time public health officials start to trace it, you're behind the 8 ball at that point.
Yeah, definitely. So we mentioned Taco Bell is taking precautionary measures, but how does a parasite like this end up in our fruits and vegetables in the first place?
Well, so how does human waste end up in the water that's being used to irrigate the crops or rinse off the crops? A lot of that comes down to farm workers not having proper access to restrooms on the job. And so, as you can imagine, if they're using, well, the fields as their facilities, that you can have contamination of irrigation water, for example, in that way.
And should we stop giving our kids fruits and salads, or even us, should we stop eating fruits and salads?
I mean, look, fresh produce, that should actually be the bulk of your daily diet. So I would not say that, but you know, it's kind of the advice we give to travelers to low-income countries, honestly, that we need to be giving right now, which is in addition to washing your produce, that's not a perfect measure. That's not going to eliminate your risk with cyclospora. So the other things you can do is cook your vegetables, your fruit, or you can be peeling it, but that doesn't work for everything. You can't, you know, we don't cook and peel our lettuce or our raspberries. Right. And so there are some fruits and vegetables that you can't do that with.
So how would someone know if they have this and it's not just a summer stomach bug? And just going off of that question too, is this something kind of like the common cold where you just wait for it to end and be done with, or do you have to go see a doctor?
You don't have to go see a doctor. If you're somebody who is older or it's an infant, you know, young child, those are the groups that we worry more about. What can tip you off is that you're having long duration of diarrhea. If it's just a summer diarrhea bug, that's usually only a day or two. But with cyclosporiasis, it can last a week or two. And that's why people are also more at risk for dehydration with that. If it's lasting that long, that's when to go see a doctor to specifically ask for testing for this. There is an antibiotic that works. But big picture, the reason we don't have a ton of tips to give consumers is because this is really the job of FDA, CDC, public health to prevent this from happening in the first place.
Yeah, that's right. Dr. Celine Gounder, thank you for your time today. We appreciate it.